We're here because 3 young adults in our community have been diagnosed with meningococcal disease. We begin with thoughts of the ill and their families. We send our sympathy, and we look for each to experience a speedy recovery. This press conference will provide information on the status of meningococcal disease in our county, vaccines and their usage, and steps being taken to prevent the spread of the illness. This is a joint effort. The Public Health Department is working very closely with the University of California at Santa Barbara staff and their leadership, with the California Department of Public Health in their guidance, and with a consultation from the Centers for Disease Control. I have to tell you, the coordination has been exceptional and essential for this time-sensitive health issue. Each of our speakers will speak briefly this morning. We also have Dr. That area. He will be able to answer those for us. We'll begin with Dr. Charity Thoman. Dr. Thoman is Deputy Health Officer for our Public Health Department, and she'll talk about the public health response.
Hi, thanks for coming today. I'm Charity Thoman. I'm the Deputy Health Officer at the Public Health Department. I want to begin by offering our sympathy and support to the families and the students who have become ill and wish them a speedy recovery. I'd also like to thank the coordinated efforts of UC Santa Barbara, the California Department of Public Health, and the Centers for Disease Control. They've all been excellent partners in responding to this outbreak, and they've all been very proactive. I want to start off with giving a brief description of meningococcal disease. First of all, meningococcal disease is caused by the bacteria Neisseria meningitidis, and there are a few different forms of the disease. There are basically 2 different types of manifestations of this disease. The bacteria can go to the brain and it can go to the blood. It can also do both. When it goes to the blood, it's called meningococcemia, and when it goes to the brain, it's called meningitis. The signs and symptoms that we look for with meningococcal disease can include fever, headache, body aches, rashes, nausea and vomiting, or stiff neck. The fatality rate from infection with this bacteria ranges from 10 to 20% based on the individual case. The transmission is something that's very important to public health because this bacteria is transmitted by close contacts with infected individuals who are ill. And we really get specific about a close contact. That involves sharing respiratory secretions such as saliva, sharing drinking cups, sharing cigarettes. Any kind of kissing or very close personal contact is considered a close contact. The treatment for meningococcal disease involves antibiotics for the ill patient, and the treatment for individuals who were exposed through a close contact involves prophylactic antibiotic treatment. There is increased risk of meningococcal disease in college settings. The reason for that is that in college settings, such as dormitories or close housing units, there's close contact of individuals and an increased opportunity to share respiratory secretions or saliva. And so that's why public health gets involved to initiate a contact investigation, find the close contacts of ill individuals, and provide them with antibiotic prophylaxis. I'm going to give you a brief summary of our current situation. I can confirm that we have 3 confirmed cases of meningococcal disease at UC Santa Barbara. This does meet the definition of an outbreak. 2 of these cases are confirmed serogroup B. 1 of the cases is still pending as to the serogroup. We do know that the 2 first cases match each other genetically, so they are linked, and tests are pending on the 3rd case. The onset of illness for these cases was November 11th, November 13th, and November 18th. And in response to these 3 cases, the Santa Barbara County Public Health Department, in coordination with UCSB, is providing antibiotic prophylaxis, and thus far we have treated over 300 students at UCSB who met the definition of a close contact to one of these cases. The most important thing that students can do right now to keep themselves safe and well is to practice good respiratory hygiene. That means covering your mouth when you cough, not sharing eating utensils or cups with someone who is ill, and making sure to avoid close contact if you yourself are ill. When we prophylax a close contact, someone who shared respiratory secretions or saliva with the index case, we look at 7 days prior to the onset of illness. So if a person became sick on November 13th, for example, we would look at contacts who had had close contact with that person going back 7 days before. And then we have 14 days in which to provide the antibiotic prophylaxis to that close contact after the initial contact. I can tell you that we're working very closely with both the emergency room at Goleta Valley and Santa Barbara Cottage Hospital. They are on alert for new potential cases. We're also working closely with our community providers, our primary care physicians out in the community, and they are on alert for cases as well. We are closely following the blood tests of suspected cases. We're working with the California Department of Public Health, who is performing further testing on these blood samples. And we are sending some of the specimens to the state for further testing. The Centers for Disease Control has been very helpful. We've been in close consultation with them since the beginning. And I wanted to briefly discuss the situation with vaccinations, since there's been some confusion. I want to clarify. Because this outbreak involves serogroup B, that's a very important point, because the vaccines that are approved for use in the United States cover 4 serogroups, A, C, W, and Y. This means that the vaccines that are approved for use in the United States that may have been administered to these college students do not cover serogroup B. Serogroup B is not included in that vaccine, and that means that students who did receive the meningococcal vaccine, while that is recommended by the Centers for Disease Control, will not be protected from that vaccine against the current outbreak. Santa Barbara County Public Health Department has established a hotline number for providers to call if they need further information. We are also asking that suspected cases be reported immediately to disease control. We have a 24-hour line, which is 805-681-5280 for immediate reporting of suspected cases.
Thank you. Thank you, Dr. Thoman. We'll also have an opportunity now to hear from Dr. Mary Ferris. Dr. Ferris is the Executive Director of the Student Health Center at UCSB.
Thank you. At UCSB, our Student Health Center sees 200 patients a day, and we've been on high alert ever since these cases developed. The university's responded quickly to work closely with the Public Health Department here in Santa Barbara County to treat all of the close contacts, and we've had extended hours and made it as easy as possible for students to obtain that treatment. We've also mounted a public information campaign to our entire campus community so they're aware of the symptoms of the disease, and we're encouraging them to seek medical treatment promptly so that we can intervene quickly if they do indeed contract this disease. We've sent communications both to the students, the campus community, and to the parents to keep them informed, and our student health website provides continuous updates as we get new information. We're still encouraging students to obtain vaccination for the meningitis, with the meningitis vaccine that's currently available, because we believe that does control the spread of meningitis disease, meningococcal disease, and we have extended flu shot clinics along with meningitis vaccine clinics to all of our campus community. Thank you.
Great. So we have an opportunity to ask questions. If you have any questions of either Dr. Thoman or Dr. Ferris. Yes.
I'm curious, do you know where these patients, if you will, where they traveled before the 7-day window prior to that?
Travel.
Were they elsewhere other than UCSB, other than Santa Barbara area?
Although there has been a little bit of travel identified in these cases, there's nothing that suggests that they obtained the infection elsewhere or that they brought it to UCSB from another place.
Can you say where they were before?
No, I can't disclose any particular information about any of these index cases.
Yes.
Is this the same strain of disease that was identified at Stanford?
So I can...
Princeton, I'm sorry.
At Princeton, I can confirm that the Princeton outbreak does involve serogroup B, and this UCSB outbreak does involve serogroup B, but there is no link between them. We've sent the specimens to the Centers for Disease Control for testing to confirm that. At this time, we have no evidence suggesting that there's any link between the two outbreaks.
Dr. Ferris, are students required before they move into the dorms to get this vaccine? I know Cal Poly and San Luis Obispo, they are required.
No, at this time, the University of California doesn't require specific vaccines except for hepatitis B, which is a state mandate, but it's strongly recommended. And we always encourage that, and we promote that a lot to all the incoming students.
Yes.
You said that there were some students who were suspected to have the disease and they were going through blood tests. I was wondering how many students.
I can confirm that we are doing ongoing testing of students with concerning symptoms. I cannot confirm the number as that's changing. What we are doing is testing the blood samples of students who have concerning symptoms to make sure that we identify any cases. At this time, I can only confirm that we have 3 cases, and if that number changes, we'll update you as soon as we know.
Can you give a range? Is it 5? Is it a dozen?
That number is changing on an hourly basis. I can say it's less than 5.
Any other questions?
Two-part question, actually. First of all, are all 3 of the patients, were they all within proximity of one another? Is that why all 3 of those patients have contracted the disease, or were they spread throughout the campus? And then secondly, Santa Barbara City College has a large population out there in the Isla Vista area. Are there any concerns with Santa Barbara City College students being in contact with those patients and spreading to Santa Barbara City College?
Okay. To answer your first question about proximity, as part of our contact investigation, we identified close contacts to the index cases, and we have been able to determine that there was some contact, we don't know how much, between the cases, not necessarily primary contact, but maybe secondary contact. If they shared a friend or if they were present at the same social event, we can confirm that that was the case. And remind me, what was your second question?
With the City College population.
At this time, we have no reason to believe that the City College population is at increased risk for meningitis. We have no reason to believe that there are contacts there who we are concerned may have meningitis. But if that situation changes, we will let you know as soon as we know. Yes?
Can you say where they were living? Were they in apartments? Were they in the dorms?
I don't think I can disclose where they were living at this time because it's personal contact information.
Was it on campus or off campus?
There's a variety of living arrangements. I think we can just say that in a
I
broad way.
can confirm that at least 2 of them were on campus.
They were living on campus?
Yes, at least 2 of them were living on campus, but I can't tell you where.
Is this an unusual strain of the disease? I'm just wondering why there isn't a vaccine available here in the country.
Yeah, it's actually not an unusual strain. In the United States, we do see the majority of meningococcal disease is caused by B, C, and Y. So it's not unusual to see serogroup B in the United States. The FDA has not approved a vaccine targeted at serogroup B at this point.
Any other questions?
Could you just briefly say why the FDA hasn't approved this vaccine?
I would be happy to defer that question to the Centers for Disease Control. Dr. Clark, would you like to respond to that question, why the FDA has not approved a vaccine for serogroup B?
Sure. So there are 2 companies that make vaccines that are working on serogroup B vaccines. One has been licensed in Europe and in Australia. In the case, so the companies tailor their vaccine development to the epidemiology of the countries. And so in the case of the Novartis vaccine, they're actually working on an A, B, C, W, Y 5-component vaccine that would make sense for the U.S. market. There's not been an FDA decision on either of those vaccines in development.
Any other questions? I'm happy to say that Dr. Ferris and Dr. Thoman and Dr. Wada, Takashi Wada, our Department Director and Health Officer, is here. So they're available to speak with you after if you would like to. Again, I feel like we are very fortunate that although we have this difficult medical condition, we have a wonderful working collaborative group working together. And I can tell you they are on the phone daily working closely together. We want to remind medical providers that if they have any concerns about patients showing symptoms, that they make reports, which are required by law, and that we will continue to coordinate with our partners. We'll keep you informed as changes occur. We will continue to sound out information. Just as Dr. Ferris talked about sending out information to UCSB, we will do the same thing to the Public Health Department. And we thank you for taking your time to be with us today.